Good morning and welcome to the Standing Policy Committee on Community Services for Wednesday, February 5th, 2025. My name is City Councillor Vivian Santos for the Port Douglas Ward. I am your chairperson, together with Councillor Matthew Allard from St. Boniface and Councillor Sean Dobson from St. James. Also want to acknowledge the Winnipeg Public Service, our senior committee clerk, Peter Prinsloo, and other members from several departments. I want to also acknowledge that we are meeting on Treaty 1 territory, the traditional homelands of the Red River Métis that we all have the privilege of living on. Also want to acknowledge our ancestral territory lands, and that our drinking water comes from Shoal Lake Band number 40, as well as our neighbors in Treaty number 5, where our hydroelectricity comes from. First up, we do have one councillor, Councillor Cindy Gior, that is not able to attend. She has notified us, so I'll need a motion for her to.
Motion.
Okay, to, what's the wording you'd used?
That Councillor Gilroy be granted leave of absence from today's meeting due to a personal family matter.
Perfect. All those in favor?
Aye.
Aye, and that's carried. We're moving on to our appeal hearing.
Motion to accept the minutes of January 10th.
Thank you. Yes.
And 15th.
There's two of them, two
Yes.
meetings.
Oh, there's
January
two.
10th and January 15th to be taken as well.
Okay, I didn't realize
Okay,
you did.
by Councillor Dobson.
Yep.
All those in favor?
Aye.
Aye, and that's carried.
All right, so first on our agenda is an appeal hearing at 635 Mulvey Avenue. This appeal has been invalidated, however, due to the provisions of section 1.106.1 brackets 1 of the neighborhood livability bylaw. That provision states that an appellant must post a poster at least 7 consecutive days ahead of the meeting, and that has not been completed as per the inspection report, which is on page 15 of the exhibits. So therefore, the committee can simply move on to delegations at this time.
Okay. We do that. And is that appeal remains open until everything is done appropriately? Does it come back to this committee?
No, this appeal is invalidated, so it's
It's gone.
It's gone. Okay, we'll move on to delegations.
Are they able to file again?
no.
No, they're not. Oh, okay. Final question. Okay.
I see we have two people in delegations. We have the first one, Krista Borskevich, and second one, David Grant. David had requested to go first, and that's okay with Krista. Okay. All right, David, come on down, sit down. Great to see you in person here at City Hall.
Thank you.
Nice to officially meet you in person.
About once a year. Anyway, I'm commenting on report number 1 on the fire service and related stuff. It's a very thorough report. I was very pleased to read it. And on the topic of toxins, people didn't worry about that before. I've worked in places where the toxins would kill you, lead refineries and uranium refineries. And so I appreciate this stuff, and I'm glad to see this being dealt with. And on the other hand, the problem of unsafe structures remains. I understand that we've had 3 firefighters injured recently by unsafe structures that they were in. I'm not sure they were all falling through the floor, but that's a danger. And I suggest that every structure that's been fire involved require a permit. If it's not going to be immediately repaired, that it have an inspection certificate. And so that if there's a subsequent fire, before the fire service goes into the building, they would look at that report, and the report would say floor unsafe in rear half, and they would maybe decide not to go in. But certainly the time to look at it is not when there's a second fire going on. It's when the everything is calm and cool after the first fire. So just that's something that it's a topic that we dealt with when I was with Hydro. We had our own internal fire service, and we had this was a topic at a safety meeting about 15 years ago. There was a large warehouse or something in the Boston area. Firemen went in because they thought there were homeless people living in there, and I think they had 3 firefighters killed because things went badly during that fire. And so we took that very seriously at a safety meeting and decided that there are a lot of cases where if it's too dangerous, and there's no need to have a fireman in there. So I think it'd be worth having this, and this is a standing policy committee, and this would be a policy that you could perhaps work with the service. And in general, I don't like more paperwork and more reports, but I think this one could save prevent injuries. And I'll leave that with you. And thank you for the chance. Anybody have any questions?
Well, I was gonna point out that that makes really good sense in that if there was a fire in a building and the building was damaged prior to boarding, we would board it up. And then if there was another fire, the firemen would be able to look at the report and say, you know, that building is really, really damaged on the inside. We can't go inside. It's too dangerous. We'll have to fight it from the outside. That makes total sense. I think that's something that we should pursue.
Thank you.
Any other questions? Thank you. Thank you, Mr. Grant.
Thank you.
Thank you very much.
Okay, up next, we have Krista Boroskevich, Director of Animal Advocacy and Legal and Government Affairs, Humane Society. Welcome, Krista.
Thank you, and good morning, councillors.
Morning.
Thanks for allowing me to speak today on item 3 of your agenda, which is the service agreement between the City of Winnipeg and the Winnipeg Humane Society. I'm going to keep my comments short and sweet. So as Manitoba's oldest animal welfare organization, established in 1894, the WHS has continuously undertaken means to innovate, adapt, and evolve to meet the needs of Winnipeg's animal population and the community that cares for them. We're very pleased with our partnership with the City of Winnipeg and its Animal Services Agency. We think this is a prime example of a model that showcases the value of working together. I'd like to highlight just a few of the benchmarks that the contract between the city and the WHS has allowed us to achieve over the past few years and will continue to allow us to achieve should SPC approve or I guess recommend approval of the report before you. So as you're likely aware, the WHS is the primary shelter for stray and community cats within Winnipeg. Through our partnership with the city, the WHS is able to assist approximately 4,400 cats each and every year. From attending to medical needs, to providing spay and neuter surgeries, and eventually to finding homes. Whether that's an adoption into a household, placement through our Barn Buddies program, or a return to community for a so-called colony cat. Speaking of spay and neuter surgeries, our partnership with the city also allows for the provision of low-cost spay and neuter surgeries for pet owners that couldn't otherwise afford it, which helps manage Winnipeg's pet population and ensures that unwanted litters are prevented. And I can tell you just in 2024 alone, through this partnership with the city, nearly 3,000 surgeries were performed. The actual number, 2,777 surgeries, spay and neuter surgeries were performed. Nearly 2,000 cats got spayed or neutered and just under 1,000 dogs. This partnership also assists the city in procuring veterinary services from the WHS's in-house clinic at lower cost than if the city was using a for-profit third-party provider. This ensures that dogs taken in through the Animal Services Agency receive medical treatment when they're sick or injured, including advanced diagnostics such as x-rays and ultrasounds, as well as complete dental examinations and extractions when needed. The WHS also assists dogs taken in through Animal Services who have behavior issues. These dogs are transferred into the care of the Winnipeg Humane Society, where our in-house team of behavior experts works with those dogs to ensure that everything possible is done to increase their adoptability and ensure a happy and live outcome in a loving home. And the WHS also takes in puppies from Animal Services under the age of 3.5 months, as our team has the facility and the resources available to ensure that any disease outbreaks such as parvo, which can be deadly for young puppies, is successfully managed. So the WHS really appreciates the 2025 funding approved by council in the recent budget adopted in January, as well as the recommendation for annual cost of living increases. As I'm sure you're well aware, the cost of everything keeps going up, and this does include veterinary services, pet food, staff wages, and other costs associated with running an animal shelter and providing the services under this proposed contract. So the report before you seeks to operationalize the funding that council approved, setting out the details of how it's to be allocated in order to ensure that the city receives the services it requires, balanced, of course, by the Winnipeg Humane Society's ability to successfully provide those services, so that we can continue this partnership to ensure the best possible outcomes for animals that come into both of our agencies' care. I'm here before you today asking you to please support the recommendations in front of you. Thanks for your time.
Any questions? No. Could you talk to me about your veterinary services? So how many vets do you have on staff?
So that's a little bit of a question right now. We have multiple vets on staff in a full-time and a part-time capacity. We also have One Health veterinarians that travel up north to provide spay and neuter services for northern communities to help handle the dog overpopulation. Some of these are full-time employees, some are part-time, and some are contract or locum vets that go up and do that work. So I can get you the exact numbers of each of those categories for you, but I don't have that information available right now.
Thank you.
Yeah, you're welcome.
Right, seeing no other delegations, nobody in the gallery wanting to speak. Okay, we'll move on to reports. Up first, we have the Winnipeg Fire Paramedic Service Strategic Direction Update. We have Chief, morning, welcome.
Good morning. Joining me this morning is Assistant Chief Lisa Gilmore.
Sure.
She'll actually be speaking to report number 2 on the agenda. Good morning. The report before you is item 1 is the Winnipeg Fire Paramedic Service Strategic Direction Update. This is the first time that this update is coming forward to the committee in written format. Since 2020, the service has been providing updates, and last year at committee, the decision was made to move to the written format. So that is what is before committee today, and this report is to be received as information. There's basically 3 areas highlighted in the report as requested by the committee and council. The first being an overview of the overall implementation of the master plan since 2020. Second area is includes data updates. And the third is a progress update on our infrastructure builds as outlined in the master plan. The 2018 master plan recommendations address infrastructure and operating capacity deficits that challenge the ability of the department to fill its response and regulatory mandates. The master plan provides recommendations to address the gaps identified in the previous fire underwriters survey and community risk assessment standards of coverage reports to prepare our city for its current and future emergency services needs. As we know, the city's population is at 815,000 plus, and the Winnipeg Census Metropolitan CM area is in excess of 910,000 in 2023 and has since grown. So this is population growth of 3.9% or over 30,000 people, and that's since the last underwriters report. As of 2023, the city of Winnipeg is recognized as the 6th largest municipality in Canada. As of 2023, we are also Canada's 7th largest census metropolitan area. Out of Canada's 41 CMAs, Winnipeg ranked 8th for overall increase in population and 12th for the percentage increase in population. The WFPS master plan provides a roadmap for the department to respond to community growth and development. And this is an effective policymaking and budgeting tool for the department. A significant recommendation of the WFPS master plan report is that no reduction of response personnel or vehicles should occur. The report also recommends increasing and repurposing the response and support resources for the greatest efficiency and efficacy in Winnipeg. The service has focused on following key areas in the report. First being the consolidation of stations 9 and 15 with the new station at Autumnwood and Cottonwood Drive. The installation of a modular station at 1310 Eaglewood Drive in Waverly West in advance of the permanent station, which is located at Ruth Crossing and Bison Drive in Waverly West. The implementation of traffic preemption pilot project, which took effect in April of 2024. And this involves 17 intersections along the major Osborne Street corridor. We also have in the master plan suggested improvements that apply solely to paramedic services within Winnipeg. This, of course, is achieved on a full cost recovery basis through the contract that we have with Shared Health Manitoba. Part of that contract includes a mechanism for discussing volume-based funding increases and a dispute resolution process in regards to funding. And these are processes and discussions that are currently underway with Shared Health. The master plan also recommends investments in the following areas: updating stations to meet the current health and safety requirements, updating stations to ensure there is no negative impact to the city's fire insurance rating. The public fire protection classification is based on the evaluation of the fire department, water supply, fire safety control, prevention, and fire service communications. The City of Winnipeg has achieved a public fire protection classification rating of 3, and that is on a scale of 1 to 10, 1 being the highest. Additionally, the City of Winnipeg has a dwelling protection grade from fire underwriters, a grade of 1, which has been maintained by the city. The scale for the dwelling protection grade is a scale of 1 to 5, with 1 being the highest rating possible. And again, our grading is 1. We are also updating our training facility to meet capacity needs, also increasing the current staffing complement in the fire and injury prevention branch, and looking at improving our heavy fleet. That's the fire apparatus that we have in the complement. There is also fire safety control and pre-incident planning work that was undertaken since the last fire underwriters survey and master plan. Moving on to data updates, our service uses data to determine where resources are best located. It is well known that WFPS is under extreme stress in both fire and paramedic operations as call volumes have continued to increase significantly. As outlined in the report, medical and fire call volumes have increased steadily, which has impacted response times and the staff that work for us. The number of fires increased by 33% between 2022 and 2023. Fires increased by 87% between 2019 and 2023. We see significant increases in outdoor fires and fires in residential properties. This includes vacant properties. Medical calls increased by 7% between 2022 and 2023, and medical calls increased by 23% between 2019 and 2023. Winnipeg's high rate of urban poverty and crime are contributing factors to the increased fire and medical call volume. Other contributing factors include overall population growth, as addressed earlier in the report, socioeconomic challenges such as poverty and addictions, older housing stock in certain communities within Winnipeg, drought conditions that were experienced in our municipality in 2023, and an increased number of individuals living in encampments, outdoors, and using fires to keep warm. In terms of vacant building statistics, those are outlined in the report. The report is missing the last 3 months of 2024. That's data that we're currently attempting to finalize. Once finalized, it will be posted to the city's open data portal. In terms of encampment data, In collaboration with our community partners, the Winnipeg, City of Winnipeg and the WFPS employ a human rights-based approach to responding to reports of encampments on public property. Between January and November 27th of 2024, there have been approximately 512 encampment fires noted by our Winnipeg Fire Paramedic crews. And these included all types of fires. Fires which were reported to 911, resulting in crews responding. Fires which were also reported by the general public, and incidents that were investigated by our fire prevention officers. In terms of substance use data, there is an appendix in the report. This depicts the substances and the statistics from 2016 to 2024, broken down by month. And the data shows that from 2016 to 2023, WFPS recorded a 1,372% increase in the number of medical calls related to opiates. In 2023, for the first time ever, there were months where WFPS responded to more calls related to these drugs than calls related to alcohol. And that is the first time ever that we've seen that change. Moving on to Waverly West Station updates. The modular station was delivered and is currently in place at 1310 Eaglewood Drive in Waverly West. We had the grand opening for that last month. The service anticipates deploying crews from that location until the new station is built at Ruth Crossing. In terms of Ruth Crossing, that will be the permanent build in Waverly West. We are in the process of finalizing the contract procurement process. In the month of March, we are looking at a staged tendering for that building. And we are hoping operational status of that station will be in Q1 of 2027. The final item outlined in the report is emergency traffic preemption. This is a pilot project. Winnipeg currently has an emergency vehicle preemption system in place at 24 of the city's 681 signal intersections. The existing emergency vehicle preemption system consists of a hardwired or radio connected system between our fire paramedic stations and nearby traffic signals. In April 2024, a pilot project was established along the Osborne Street corridor, and this was initiated involving 9 of our emergency vehicles from stations 1, 4, 5, 13, and 30. And the system involves a wireless connection between those vehicles and the traffic signals. The pilot will run for a year and allow WFPS and the city's signal branch to evaluate the system, to make adjustments and document the benefits. It's also important to note that in advance of the completion of the pilot, we have secured budget funding in the 2025 budget to move ahead with this project. In closing, I just like to address the very important comments by delegation in speaking to the report in terms of crew safety. I will assure the committee that we do have processes in place to ensure that concerns regarding vacant buildings in the community are documented in our electronic dispatch systems. So our responding crews have up-to-date information on the properties that they are responding to. That is information that can be updated by our incident commanders, crews that work in the area, and also our fire prevention personnel. We also receive information from the Provincial Department of Justice regarding properties within the City of Winnipeg that Justice is concerned about, and we have that information logged in our systems so that our personnel are aware. And that concludes the report. We have to take any questions from you.
Any questions? Go ahead, Councillor Johnson.
For the traffic signals, the pilot program, are there very many other cities that already do this?
There are some in the United States. Former Chief Lane actually, as part of his master's studies, did his studies on preemption. So we have There are a number of cities in the US. Many of them, though, are using older technology, and the technology that we're using is state-of-the-art wireless technology using
Okay,
the cellular system.
My second question would, how much time do you figure this is gonna save getting to a fire by having the lights change prior to you getting there?
It can save several minutes. So it's important on a couple of fronts. Number one being the time saving, and this time saving is also identified in the master plan. The time that we're going to save is also going to allow us to consolidate stations. So a good example of that is the consolidation that's currently underway with stations 9, 15. So it will allow us to consolidate stations. And that's important because all of our stations are pre-Unicity, so pre the city of Winnipeg. So many of them are not in the ideal location. So part of this plan will be to ideally locate the stations and consolidate so that we have less infrastructure, but still remain the number of vehicles that we need to respond. The second important part to that question is crew safety. So we have a number of vehicles every year and crews that are involved in motor vehicles collisions at intersections. Some of those result in injuries to the public and also to our staff and workers' compensation claims. So simply from a public and crew safety standpoint, if we can guarantee a green light for our vehicle so it can go through the intersection on a green, that's a huge benefit for us.
Okay, and I guess that stands to reason that you'll get to the site quicker and possibly save lives.
Correct.
That's important to know,
Yeah,
I think.
and so while the trial is underway on the Osborne corridor, we already know there are a number of intersections in Winnipeg that are high-risk intersections. So once the proof of concept is done through this trial, we'll be looking to move forward with introducing this technology at those high-risk intersections.
Okay.
On that, Madam Chair.
Yeah.
Forgive me if this is a technical question and if there's no answer right
I'll
now,
try.
I can always ask again. But did you say that the vehicles are communicating directly to the traffic signals? And the second question is, I heard the cellular network, and I'm envisioning, I don't know, some kind of public, like a significant public disruption and the effect that has on the cellular network and how essentially it goes down and whether or not that would have implications in that type of scenario. I know the police have their own radios,
Yes.
so whatever happens, police can still communicate, but I'm wondering how that would work with the traffic signals.
Yeah, I don't have, there may be some involvement with the radio system. And currently that's a closed system here at the city. But it does communicate with the vehicle, with the traffic signal, and there's also a piece with the traffic management center. In terms of disruption to the general public, before we actually even went forward with this pilot project, there was a consultant hired by Public Works through the traffic management center that did a review of this, and it was determined that any disruption would be minimal, and the recommendation was to proceed with the pilot project. So.
Okay, well, I like the direction. I'm aware, like I've experienced having no reception when there are too many people using the towers, so that's why I asked the question. Thank you.
And then tying into Councillor Dobbs' question about, I think you had mentioned here, placed EVP system in place at 24 of the 681 signalized intersection. So with your pilot project running for 2025, are you expanding it to the other 681 signalized locations? You'd mentioned some higher areas. I don't know if you can name them publicly, but.
We'll start with higher areas. One of them is Lagimodi and Region. So there's a significant number of lanes of traffic there. And we've had a number of accidents occur at that location. And there are others. In terms of what's in place now, we've had for many years signalized intersections. For example, the station, our main station on Ellen Street, 65 Ellen, There is a switch within that station where when the crews leave to respond, they press this button and then the traffic signals within the area of that station, most notably on Notre Dame and Cumberland, will turn green to allow our vehicles to move southbound down the one-way streets. So when we have other intersections, Station 3 on Desmiron, Station 11 on Portage Avenue, or Banting Street Station. Most of the stations that are near major thoroughfares already have wired technology, but it only controls one or two of the lights in the area. This system would allow the vehicle to actually guarantee green lights for their entire travel time to the incident, which is far simpler.
Any other questions? No? Seeing none?
Just confirming that apparently most EVP systems do use the cellular network and most use radio as backup. I guess that's how it is.
I don't know 100% about the radio, but
Yeah,
cellular, I can say yes.
okay.
And to confirm, you guys are gonna come back, so this is gonna be a yearly written report, is that my understanding? Because right now we're just.
That's the plan.
Okay.
Yeah.
Okay,
And of course, as we move through, you're going to hear different things. So right now, in terms of our capital infrastructure projects, we're talking about Waverly West and the Autumnwood and Cottonwood Station. That's going to change as we move through. You'll see in our budget documents with our capital building plans, we have Station 19 at Whitewold and Whitewold Avenue planned for a rebuild. And we also have Station 4. So as those projects progress, they will flow into this report so that committee will get updates on those capital projects.
and similar with the other the data points that you've mentioned on calls for service, fire statistics,
Yes.
and the drug ones. Okay, perfect. Great, this is great data, really important, appreciate it, it's a lot of work, I know it is a lot of work, but we always appreciate you guys doing that. So-
One more general question.
Sure.
It's related to the preemption of the traffic signals, which I think is just fascinating. Apparently a radio system could, if the cellular system goes down, interact directly with traffic signals. But my question is more general in that if this works for the fire paramedic service, and would something new be possible with the traffic management center using this technology for just general traffic flow? And I guess are you talking to Public Works as you're having these discussions? And
They're a partner in it.
yeah, so they're aware, and so
Oh,
they
yes.
might be able to flag if there were
Very aware.
opportunities for the public or
Yes,
general application.
or other city departments.
Yeah, okay, great. Thank you.
Good. Anybody willing to move the motion for information? Counselor Dobson, all those in favor?
Aye.
Aye, and that's carried. All right, moving on to our next report, Firehouse Subs Public Safety Foundation Grant, I believe.
Great.
Yes,
Yes, Assistant Chief Gilmore will speak to this report.
Good morning. So we were fortunate to win one of the grants from Firehouse Subs Canada that we applied for. And we're here today just to ask for council approval to enter into a conservation agreement with Firehouse Subs Foundation of Canada to be able to receive that grant. And it's going to be applied towards equipment for our fire public education branch. It is two kitchen hazard simulators. So if you've ever been in our fire trailers during the summer, there is a simulator in there of what a stove or an oven would look like, and children can go in and practice safe cooking practices. So these are two portable kitchens that we can bring to schools, we can bring to newcomer groups, we can bring to other presentations and allow them to actually simulate while we do the presentation.
Okay. Any questions?
I was gonna ask
Yeah.
a question of where they bring these trailers, but you answered it.
The trailers only go out in the summer, so we're restricted to use them when there's no snow on the ground. So these will allow us to do the same type of presentations throughout the year. So trailers don't usually cover the school year because we usually close them up in the fall and then only take them out in May. So these will allow us to cover schools and use them in school presentations throughout the year when the trailers aren't available.
Another question I would like to ask is, who books the trailers? Is there any particular group that books these trailers, or is it just part of a program from the Winnipeg Fire Department?
So we run them with summer interns. So most of them are university students that join the public education department in usually late April. And then they work from April, May, June, July, and August. And we have 2 of the trailers and they can be booked. They're free. You just need to call us and make time on the schedule. We go to festivals, daycares, schools, anything like that.
All right, I'll take that. I'll write that down.
Yes,
Counselor sponsored community barbecues.
all the
we show
time.
up there.
Yes, any community event we're happy to go to.
Awesome. Thank you very much.
Yeah.
Especially with fire alarms. Are fire alarms part of the display?
Smoke alarms.
Yeah,
Yes, we do have one that we already bring out when we go to school presentations and we turn it on, let the kids see and to any other presentation, turn it on, show how to test your smoke alarm, go through the importance of where you place it and stuff like that. Obviously, the conversation is tailored to the group that we're speaking to.
what prompted my question is the other day when I was testing my smoke alarm, several people in our house have these audio canceling headsets and may or may not hear the carbon monoxide, CO or CO2 alarms. Are any of these devices, do they have like other means like flashing or other means to indicate to a hearing impaired person that there's a fire going on? Because I had the thought when we were hearing, like we weren't hearing anything because of the sound canceling headphones.
Yeah, you can definitely get different alarms if you are hearing impaired. That would be the light, but again, they're not as effective because you have to be in the right space to see it at all times too, right?
Right.
So there are different types of alarms, but the one that we use the most often and that we install is just a tone.
Okay. It was just one of those moments where I realized that certain vulnerability.
Yeah.
Okay, thank you.
On that point about smoke alarms, I saw in the earlier report, there was the talk about going into more of the inner city neighborhoods to actually subsidize smoke alarms in the community. Are we doing that here in Winnipeg?
So we have the Safe Family Program, which if you call the number, you can book an appointment with one of our crews that will come out and install an alarm or just help you check your alarm if you're not sure about it or test your batteries. Last year, we used some of our accommodated staff in the spring, and we actually targeted certain neighborhoods that had had a fire. We went door to door, handing out information, offering to install an alarm while we were there, showing people how to test their batteries. And we were able to, in about a month and a half, install more alarms than we had the previous year. And then we almost quadrupled our overall alarm installations in the high-risk neighborhoods from the previous year by doing that door to door.
Nice. Okay, excellent. Great work. Okay.
Great.
Seeing no other questions, thank you.
Thank you.
I'll entertain a motion
I'll
to accept the public service
I'll move it.
recommendation, which is gonna go all the way up to council.
Thank
Okay.
you.
Thank you.
All those in favor?
Aye.
That's carried unanimously. On to the next one, service agreement between City of Winnipeg and the Winnipeg Humane Society. I believe we have the director as well as animal services. Welcome.
It's vibrating.
Got a 10-year one.
Yeah.
Carbon monoxide.
I get your bed. Yeah. Oh, yeah. Sweet.
One in every bed. One in the hallway.
Yeah, but if you're deaf, you'll hear it. You need to have that, you need to have some really bright
They all have
lights.
lights.
Okay, go right ahead. Thank you.
So I'm Director of Community Services, Cindy Fernandez, and with me is Jennifer Harrower, who's our acting. And so I also want to acknowledge and appreciate Krista Perscavich's delegation today in support from the Winnipeg Humane Society. We've been working with the Winnipeg Humane Society collaboratively for a number of months as the Winnipeg Humane Society service agreement did expire officially, I guess, December 31st, 2024. So we've been working together on a new agreement, of which what you have in front of you are the terms and conditions of the new service agreement. And so I'm going to hand it over to Jennifer to give you some highlights because she's been involved throughout the whole process.
Thank you. Morning, councillors. So as mentioned, our service agreement expired December 31st of 2024. We have made some changes to our agreement, kind of shifting in the way that it's worked in the past. And I think both parties are really satisfied with the agreement moving forward. The next agreement we were proposing to expire December 31st of 2027. So we're looking at a 3-year agreement. We're doing general animal services at a cost from the city at $587,500. So that's just the like the second injured that Krista talked about, the dentals and the puppies that they would take on for us. And then we have the spay and neuter program. We'd like to contribute $400,000 for a low income spay and neuter project. And totaling the amount of the agreement, $987,500. With the annual budget approval by council for 2026 and 2027, we would also like to include kind of the inflation rates, I guess, if you would call them, for every year moving forward. Yeah, and that's about it.
So there's no incremental funds being requested. It has been the service amount of the contract has been included within the 2025. So it's the terms and conditions of so that we can go forward as the next step, working with legal on the actual agreement.
Any questions?
I was going to ask if it was already in the budget, but she says it is. It's just going forward for 26 and 27 that you're looking at.
That's right. It's it would be a 3-year service agreement.
Yeah.
With the funds being provided in all 3 years. So we timed it with the next 4-year project.
Yeah. So, Madam Chair.
Right.
Looking through the documents, I was wondering about like a cap on spending. Like, let's say there's way more service required and demonstrated by the Humane Society. And I know that the document says that it's subject to council approval. It's a 3-year agreement. Either party can cancel in 90 days. But is it a fee for service type model? And if there's a lot of service, what I guess a report comes forward saying, this is where we're at. There's this request for service. What do you want to do, council?
We did look at past kind of expenditures on these different services. And we reached the cap number is slightly higher than kind of the average that we were spending year to year on the particular services. And now we've agreed that it'll be based on invoicing. So the Humane Society will invoice animal services for every service provided under these different, I guess, articles. And then we can watch as the year progresses on when we're coming close to a cap. And if we are, and there's room in a different article that we haven't gotten close to a cap, then we can borrow from that kind of allotment to transferring to that service if we're needing more. Let's say we have an overflow of puppies in 1 year that will kind of expend our $25,000, then we can look at if we have no dentals completed, we can kind of take them funds from the dentals and use that towards the puppies if needed. So we left some movement there in the agreement.
Okay, so you have a one fund that can be applied to any stream?
Yeah, we
Is there-
just wanted to kind of break down, it seemed a lot easier for the invoicing for the Humane Society to have them broken down. Cause they'll have kind of different departments dealing with different scenarios. From animal services, it's kind of a one pocket.
Okay, there's a fee schedule, or is there not a fee schedule?
It's being finalized, yeah, from the Humane Society.
Okay,
It will be included prior to the final agreement being drafted.
do we have any idea how many animals would be serviced based on discussions today?
It's kind of based on the cost of the service.
Yeah.
So we do have an idea, that's where these numbers kind of originated from. I guess we had an estimate of how many dogs had dentals in the last few years. And a dental is approximately $500 per dog. So we kind of just averaged it out.
So what we did is we took a kind of a clean slate when we looked at the agreement this year to figure out what are the services that animal services could provide themselves?
Yeah.
What could we not? What do we need to purchase from the Humane Society? We went through the previous agreement and said, okay, this we can do, this we can't do, this we need more of, this we need less of. And looked at the history of the use of those services. So as Jennifer mentioned, how many dogs had been provided to the Humane Society for behavioral issues? How many puppies have we normally provided? How many have we sent for, sick and injured? So we did look at the history of usage. And then also compared that with some drafted fee schedules that Winnipeg Humane Society has as to what they would charge. That's how we kind of came to these various article dollar amounts.
So I've got it at 2025, the budget is 987,500, and if there are 8,500 interactions per year, the cost per interaction would be approximately $116. That sound about right?
Well, they're all different.
Yeah.
I mean, I'd have to leave that up to Krista or Winnipeg Humane Society to explain what their charges are, but I think what the charge would be for a spay and neuter versus a dental versus behavioral, I think those are all gonna be various different rates, so I don't think we can just, divide by the number of transactions.
Okay, and then how would the services be prioritized? Are there some that have to be done as opposed to those that are nice to be done? And who decides?
There's language in the terms and conditions. For puppies example, Article 1D, it's accept and provide all necessary and appropriate kenneling. There isn't an option. Our facility cannot protect puppies from the diseases like Krista was mentioning, like parvo. That could contaminate our entire shelter, which would cause a lot of deaths in dogs and a lot of high vet bills to treat. So they have a facility that can manage puppies and keep them separate from the general population. So that's kind of they have to accept the puppies. And then if you look at advanced diagnostics, Article 1E, it's based on the Humane Society's availability to assist. So we have relationships with a lot of vet clinics in the city. So we would want to go to the Humane Society first because there's a discount for us. If they cannot accept and help at the time due to their capacity issues or their staffing levels, then we can reach out to another vet clinic to help us provide those same kind of services. So we went through each article and kind of dependent on the availability and the have-tos. Like the sick and injured, that's kind of a must. They have to accept our sick and injured animals. There isn't much of an option because they have that staff. Of course, after hours, we do with the hospital clinics in the city. We have two of the clinics, Pembina and Bridgewater. But that's still that goes back to the Humane Society, and then we work from there.
So it says the agency prioritizes emergency response, public safety, followed by addressing animal welfare concerns and community outreach programs. What's the mix between our animal services agency responding to a call relative to the Winnipeg Humane Society? How does this triage happen?
Well, all of our calls come through 311.
Yeah.
We base our priorities it's related to our bylaw. So we deal with like the biting calls, the running at larges, the barkings, the licensing. Whereas Humane Society, the APOs enforce the Animal Care Act. So they're looking at more of the humane treatment of animals. They deal with the entire province. So the calls, we do have a lot of crossover on certain calls. If you're looking like in excess animals, that's under our bylaw, but when you attend, there could be problems with the humane treatment of those animals as well. So sometimes we collaborate to attend to the call and see which agency can kind of navigate through the bylaw or the act, which kind of is easier or a better outcome. But typically our calls are very different. We have a little bit more availability to attend emergency calls. We have an on-call available to police and fire in the city, I guess in general, that we attend to a fire or a police page within 2 hours, any time of the day, where I don't think that the Humane Society has that availability to attend. So if there's a dog hit by a car at 3 a.m, our officers would get there and they would have to deal with that animal. The Humane Society doesn't have officers available during the overnight. So a little bit different. So a lot of crossover, but
It does say here that the Winnipeg Humane Society does contribute to public safety by protecting the public from potentially dangerous animals, including for sick and injured animals, managing dogs with behavioral issues. I guess that's all after, after the animal's been captured.
yes, yeah. So if we bring in an animal that's very aggressive, we don't have a behavioral team on staff where the Humane Society does. So if they have availability, they can assist us. Just this past fall, the Humane Society actually came to our building and assisted training staff and helping staff with 2 of our dogs that have behavioral issues. So they can assist and give us the tips and the tricks and try to help with training ideas and stuff that we can minimize some of those behaviors so we can eventually adopt out.
Okay, and at some point something's changed, I think, because in the past I've called related I've called because there were animals that were in the city and I was referred by 311 to the province of Manitoba.
Sorry, we were repeating.
I was referred by city agencies to the province of Manitoba, basically like live animals, I guess, Manitoba, and dead animals, city of Winnipeg. Or
Well,
could it be just the type of animal?
types of animals will change, yeah, where it leads. Wildlife will typically go to Manitoba Conservation. The city does have, I don't know if it's the latest term, but it's a dead animal pickup service.
Yeah.
Where they'll pick up more of the wildlife as well, where we would attend to more of your companion animals. So if there's a deceased deer or a coyote, Manitoba Conservation will typically address that. Or if it's, a deceased dog or cat, then we would get that call ourselves. The thought behind that is we can do an ID trace, and if there's a tattoo or if there's a microchip, we can hunt down the owner, so we can inform the owner that their animal is deceased. Where wildlife is disposed of separately.
And then finally, I don't know, I guess the question I have for, well, not so much public safety, but just bird safety, is, I guess, the potentially growing number of stray cats. Do we have any information on that, and whether or not that's going to be a problem that's going to escalate in the future, or is it?
Well,
It's a problem.
it's a tough problem to solve.
It seems we don't have numbers. All we know is that sometimes people call because they see a lot of stray cats.
Yeah, numbers are very hard to trace for community cats. We do work with our friends at the Humane Society as well. It's a known issue. Of course, every city has a community cat population. We do the low income spay and neuter can assist if you have cats of your own. Licensing can assist. So when we do get these calls, we try to trace it back to an owner. If the public has a cat in their property and they can trap that cat, they can bring it to the Humane Society where they will accept it. The owner can go to the Humane Society to pick it up, and then we can trace an owner, and then we can get a license on that animal. And if there's not, then the animal would get spayed or neutered. So we're trying to minimize the growth of the community cat population. It'll be an ongoing battle that we face, I'm sure, for years to come, as it has been, historical problem as well.
So if somebody sees a stray cat, is it fair to say call 311 or call the Humane Society? Or
You can,
both?
we won't be able to attend that quick, I'm sure, to locate the cat. But if you can get a picture of that animal, or if you can see any collar or any identifying characteristics, you can feel free to call, and we will reach out and give you a call back and see what we can do to help solve that problem.
Yeah. The ones
Cats are
with
just
owners
a
seem
little,
like the easier option.
Yeah.
Should members of the public be feeding stray cats?
I mean, unless you're planning on claiming ownership.
I just know some people. And I know about the impact to cat population
Mhm.
and the challenges associated with that. So thanks for answering the questions.
Good discussion on community cats. We love cats. Any other questions? Seeing none? Okay.
Some birds don't love cats.
Anybody willing to move the public service recommendation?
I'll move it.
Okay, by Councillor Lar, all those in favor?
Aye.
It's going all the way up to council. Awesome, excellent. That is the end of our reports. Look into my committees for adjournment.
I'll move adjournment.
All right, Councillor Lar moves adjournment. All those in favor?
Aye.
Aye. We are done at 10:30 a.m.